Welcome to Voices Beyond the Spectrum. Real stories, brave voices, radiant perspectives. This is the podcast for parents and caregivers of autistic and neurodivergent children and teens. I'm your host, and each week we hold space for honest conversations, shared struggles, and hard-won victories from those who truly live it. You're not alone. Your story matters, and it starts here. Welcome, everyone, to the very first episode of Resource Hub edition of Voices Beyond the Spectrum. This new series is all about connecting families with the professionals and resources that make a difference in our community. Today, we're kicking off with an inspiring guest, Beth Abinya, a bilingual speech and language pathologist whose dedication to helping children communicate has touched countless families. She's earned her bachelor degree in audiology and speech science from Purdue University and her master's in speech and language pathology from Northeastern University in Boston, where she research focused on autism and PECS, challenging the belief that PECS teaches autistic children joint attention. With experience across both adult and pediatric settings, from rehabilitation and medical care to schools and outpatient clinics, she brings a wealth of knowledge and compassion to every family she serves. Through her private practice and her work in local schools, she continues to specialize in feeding therapies, AAC, and empowering autistic and bilingual children to find their voice and connect with the world around them. We are honored to have her join us today to launch this new series and share her passion, expertise, and heart for the communication and inclusion. Welcome, Beth. How are you?
Thank you, Carla. I'm good. Nice to be here. Thank you. I'm honored.
My pleasure. So let's dive right in to the nitty-gritty of this podcast. So for you, what does communication really mean beyond spoken words?
Communication is just essentially it's getting a message across to a communication partner. That could be through nonverbal means. So it could be through gestures, facial expressions. Sometimes it's even for some kiddos, we might gently pull the communication partner towards what we want. And it could be sign language. It's any mode of communication, AAC, any way that you can get what you want, what you're thinking, what your needs are across to the person or the people in front of you that you want to hear your message or to know your message. That makes sense.
Yeah, definitely. It truly does. As far as what are the biggest myths or misunderstandings you hear from parents?
In regards to
Communication in general. And basically, when a child is not able to express what they need verbally, what are those myths you hear from the parents?
So there are a few that I typically hear because I see a lot of bilingual children, specifically Spanish speaking, English speaking, just because those are the languages that I speak. And there are those two languages. I've also worked with other bilingual children and used interpreters, and the same thing goes. It's either just something that we think, or and also at times there are other professionals that just I think they're just not up on to date on the research, and they tell the parents that having two languages in the home can confuse a child. This is a huge, huge myth that I come across all the time. Um, and I just had this conversation 2 times last week. So that all the research shows that that is not true. So you can't confuse a child by having two languages, even three languages in a home. Multilingual families or bilingual families do not cause, or speaking more than one language and hearing more than one language does not cause a communication delay. And then in addition to that, there have been a lot of studies that show that kids with language delays, even autistic children and children with Down syndrome, are capable of becoming bilingual. And it actually can be very beneficial to them because they have two languages or more. Typically, I see two languages and two sets of vocabulary to pull from. So once they, for example, let's say I'll take Spanish and English. So in Spanish, the word for ball is typically pelota, and then in English, it's ball. So they have at least two words from two different languages to pull from when they see the ball and when they're going to label ball. And if there's other like articulation things or whatever is going on, because there's speech and language, which are two different things, which we can discuss it as well. So if they have any articulation delays, the word ball may be easier to produce than pelota. So then they can choose ball. So the research also shows that when you have two different languages, two different sets of vocabulary, it can be beneficial for our kiddos. So that's a huge one. And if you think about it, all over the world, even my husband is from Kenya and he's trilingual. And a lot of countries in Africa and have multiple languages in the country, and a lot of people speak three different languages. And then other countries in the world speak more than one language in the home, and not all children are language delayed. So that's huge, to think outside the box and think more in a worldly way, in addition to the research. And then there are the AAC myths, which if you want to discuss that at a later time, we
Yes,
can do
well,
that as well.
we'll definitely dive into that. Yeah, I know, for example, when I first, started talking to you and I let you know of what my first speech pathologist told me with Adrian, that was exactly the first thing she told me. She's like, make sure you choose one language, don't do both. But now Adrian, honestly, he'll say some words in Spanish. Sometimes he'll even tell us a different word in Italian that he hears from videos or whatever.
I'm not
Yeah.
surprised.
That
And
that that
it can be, to me, it can be a big disservice because it's not correct based on research. Also, the other thing that a lot of the kiddos that I see, some of them, their parents are only Spanish speaking. Some of their parents are bilingual, but they do have other family members, whether they're here or in other countries, that only speak Spanish. And so, if they are, research shows they are capable of being bilingual and learning both languages and using both languages. So they're able to do it. And then if you get the wrong information and you only teach them English, what happens is those relatives that only speak Spanish, there's a huge communication barrier, which causes a huge relationship barrier. And so they can't form those very important relationships with grandparents, with aunties and uncles, even with cousins, maybe, that they might be able to if they understood and or spoke the language.
I see. Thank you very much for that. And then now speaking obviously on different forms of communication, how important is it to celebrate all forms of communication? In your perspective and based on what you've seen with, parents that are new to it, that are, going also through the emotions of not understanding if their child is going to be able to speak verbally and how will they communicate in long term. So things like that.
Yeah. So that's a great question. And it's really hard for parents, as you know. I mean, just even being a parent, and even before my own son spoke, and I know, I have the whole background, and I just wanted him to speak quicker than he did. And you really want to hear your child say words. Even for some clinicians, we have to take a step back. There is something called the First Words Project. You can look it up online, and they have a really great article. It's called 16 Gestures in 16 Months. And it really focuses on the precursors to verbal language and how important they are. So it's a nice document. It talks about, pointing or just reaching your hands up. The child reaches their hands up to communicate, pick me up, hugs, blowing kisses, showing an object. There's all different gestures that we don't even realize are communication and how important they are. And that it's really important to focus on them in addition to the verbal language. And yes, celebrate all communication. There's no wrong way to communicate. Nowadays, we have so many different modes and methods of communication. The most important thing is that, your child is trying to communicate. You can mimic things with them. So if they do gestures, you can mimic their gestures or get them to mimic back. And then, work and then, model as much language as possible, and model and you still look forward to the verbal language, but there's so many different modes of communication that the most important thing is to try to understand, what they're saying, give them time, give yourself time and grace, and decreasing frustrations is really important. So, instead of focusing always on the verbal language, if they are using gestures or pictures or whatever it may be, honoring that communication and trying to understand and build that in addition to verbal language to help decrease frustrations. And, I guess that's what kind of
Yeah.
went off a little bit,
Oh,
but
no, 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 definitely. Kind of tags. ties into the 3 to 5 things that parents can do to encourage communication. Those are some great ways to go about it. As far as how can parents respond when their child uses gestures, vocalization, or behaviors to speak in a more productive way?
So if we go to gestures, you can, if you know what the gesture means, then you'll just model the language. Behaviors, if you mean behaviors, meaning like if they're getting frustrated. Yeah.
Yes, that's what I
Okay.
mean. Yes.
So first, I'm just going to backtrack a little bit. So another thing that parents can do while waiting for verbal communication is, as I said, modeling language. So singing songs. These are some of the basic things, narrating what you're doing. So if you're putting on clothes, if you're taking a bath, if you are cooking, you can just narrate that you're cooking, singing songs about it. So I'm not a big fan of Coco Melon, but they did a really great thing. So there's Baby Shark, which all kids know, no matter, I mean, I don't know, that song's been along for a long time. So they took Baby Shark, and there's an episode or a song where the children are in the bathtub and they're washing. So they use Baby Shark, the tune to Baby Shark. So they're saying, wash your arms, do, wash your hands, do. So I always sing and make up songs, and that's a great way for children to learn language. So when my son was growing up, I was always narrating and singing and all of that. So near all of those functional activities, you just talk about what's going on. You can throw in vocabulary, verbs, all kinds of things. But in terms of using gestures, so if your child is using gestures or signs or anything like that, just put the verbal to that. So if they are, let's say they're reaching towards a favorite toy, then you just say, oh, you want Mr. Potato Head. We have Mr. Potato Head. And then, go through all of the, whenever you're playing with it, sorry, narrate all the things that you're doing, the vocabulary and the verbs, not just nouns. Make sure you get like adjectives, verbs, and nouns. If your child is if they're babbling or making sounds, imitate those sounds, and then you can even add on to that. So if they're saying ba ba ba, you imitate that, and then they know that you're hearing them, and see if they'll do the back and forth, and that is a precursor to verbal conversation. Imitation with gestures, and then imitation with sounds, imitation with babbling, any of that back and forth are all precursors to verbal conversation, and then you can add on to it. So if they're saying ba ba ba, then you say ba boo. You just change the vowel and see if then they'll imitate you again. And then, sorry, I just lost track. So that imitation, and then the behaviors. It's not my favorite word to be honest.
I know. I don't like using it either,
Yeah,
but I know some of our
that's
listeners
what.
are
Yeah,
that's how they approach the reaction that our children have because of their frustrations with not being able to communicate what they need to
yeah,
communicate to us as parents. And that's how it's known through their ABA therapists. But
yeah,
I agree with you, behaviors is not my favorite.
yeah. No, that's okay.
I mean, I have obviously, I have my 2 children, and I love the fact that you did mention that, like adding on. For example, my son, he stems through echolalia.
Hmm.
So he would be when he was around 4 or 5, he would sit there and say, there,"
Uh-huh.
as a way of communicating. And
Yeah,
as a way of him, regulating his body with that stim. So I remember when the BCBA approached me and said, "You have to ignore that." I said, "No, I'm not. I am not ignoring that.
good for you.
I can negotiate with you so we don't end up
Yeah,
standings. But what I will do is I will add on to it, like you mentioned. I'll say, there's the dish that has
yeah.
or there's the cup of water you want. There,
Mhm.
but for you to say that, to acknowledge it, it's such a breath of fresh air, because I feel that a lot of the times, imagine it's like trying to tell our kids, use your words, but once they use their words, you're not listening to them. You're not acknowledging them. So how are you really
Yeah.
forcing the usage of words? So I love
Mhm.
the fact of your approach that you had towards that. And yeah, excuse for that B word that I threw in there. But it's an easier way for families to kind of understand what I mean. Because if I go through the whole, this side
Yeah.
of the word behaviors, that's another podcast in itself. So, as far as, let's say, during playtime and routines, you mentioned a lot of the singing and a lot of that to build you know, like the powerful language that comes with that, because I also see that with my daughter. Anytime she needs to learn something, she has to sing it to herself to
Yeah,
pick that up. Now let's try to shift it to the AAC device and the alternative communications. So, can you address some of the myths that come with that, with the AAC devices, and that basically,
absolutely.
that are very common within a lot of parents and professionals at times that are not speech pathologists?
Yes, of course. So there are, before I get onto that, actually, the with the singing, um and there are, if your child is speaking in two, that other thing we say is in terms of adding on. So if your child is speaking in 2 word phrases or one word, let's say 1 word phrases, then you can model 2 word phrases.
So now that we've, talked about different ways that our kiddos can build that vocabulary by playtime, let's now start shifting a little bit more into like how can we support the children that use a or adults that use AAC device and alternative communications. Can you address some of the myths that are out there for AAC devices that say that supposedly it prevents kids from learning how to speak?
Yeah. Yeah. So some of the myths are one of them is what verbal communication, and all of the research that's out there says that that is not true. And at times it can actually promote some verbal language. I feel like there is, what I feel is like a new myth that I've been told that parents have been told that if they use speech generating devices, if their child uses a device, then it's going to definitely teach them to be verbal communicators, which is also not necessarily true. But at any rate, the research does support that when a child is using a device and hearing the communication, just like when we're modeling verbal communication without a device, and they're going to be hearing it over and over and over again. So a child needs to hear vocabulary, grammar. They need to hear language over and over and over again to use it. And then the more modeling that we do of language, the more likely, if a child is going to be a verbal communicator, the quicker they're going to do that and the more likely they're going to use that. One thing that I just kind of remembered too is that when we're modeling language in general, we have a tendency to ask questions as parents. What's this? What color is this? What's that? What's this? And the best way to teach a child language and vocabulary, verbal communication, is to model that instead of asking a lot of questions. And then when we use it's really hard. And
Mhm.
then when we use AAC, so whether you're using a speech generating device or using a more low tech picture communication system, you're always going to put the language to the gest. Like I said earlier, when the child is gesturing, you're going to add the language to that. When you're using picture symbols, if you're using picture symbols, you're going to add the language to that picture symbol. You're not just going to take it. You're going to say, "Oh, you want a snack or you want apple juice," whatever the picture is or whatever the symbol is. And so the same thing on a device. You're not going to just push the buttons. You're going to model that. And as the device is saying the language, you're also going to be saying that language. And so that's another reason. So the child is going to be hearing the device, and they're going to be hearing your language. And so it's just going to, it's over and over and over again. That language is going to be spoken and heard. And so it's not going to, if it's easier for them to then learn it and then speak it, they're going to do that before they try to locate all of the icons. Some other myths are that only children who are completely nonverbal can use AAC or should use AAC or could benefit from AAC. There are some children that are minimally verbal or they do have some verbal language, but they cannot communicate all of their basic needs or wants. They can't use communication readily and functionally at the moment. And so using a device can sort of supplement that for the time being, or the verbal communication and verbal communication combined. And so it's not just for children who cannot speak. Some children, I just made a referral for an AAC assessment to in my contract position for someone who does have some verbal language but not using language in the classroom and language, able to verbalize all his wants and needs. And so the device will. Are you frozen?
I'm good. I'm
I
listening.
lost you again. Okay. So the device can also help with the communication, because what happens is that when a child is able to communicate a little bit, but they're not able to communicate the majority of what they need, you're still gonna see those frustrations and you're gonna see those communication breakdowns, and then we're gonna see those, what we didn't like to say, as, or what he didn't like to call behaviors. Because if I can't communicate to you what I need, you better believe I'm going to have to try to show you in a different way. And it might be physical. It might be, so yeah, so it also helps with that. And then some other myths, um, are that there are precursors for use of AAC devices. So you have to have a certain cognitive level. You can use picture symbols like PECs show that you use them first. That's all old information, old knowledge. So now, even if you look at the so the American Speech Language and Hearing Association website, it'll also state that there's no cognitive prerequisites for AAC. There's no, you don't have to use picture symbols first, or like tangible symbols. And so anyone can use AAC essentially.
Oh, that's great. Great information. Yeah, I know when I went to do an IEP for my son, they were saying, well, he does say some words, and I don't think he would benefit from an AAC device. It's only for kids that don't speak or can't speak. And I was like, no, that's not true. So it has
Yeah.
tremendously helped Adrian specifically be able to communicate, especially when he is getting to the point of getting overstimulated, because it's
Hmm.
easy for him to just touch an icon. If he needs, let's say, to leave the classroom, he'll just touch that icon to be able to leave the classroom
Yep.
and get that sensory break that he needs. So it
Yeah.
come to a tremendous help for us within the school, which kind of touched base on that. How can parents, the therapist, as well as the school districts work together to make sure that there's that consistency with an AAC device?
So, I mean, communication is key. There are a few different ways that schools will conduct an AAC evaluation and implement AAC use. So, some districts, like one that I currently contract with, they use an outside provider to come in. Even if the speech pathologist at the time in the building is familiar with AAC, it's just the way they do it. So they have the company come in, do the assessment, recommend a device in a program, and then they will consult. I think it's once a month, I believe, or actually it might be less than that, but they do consult with the team and check in to see how things are going and help with implementation as needed. And then the other schools, whoever the speech pathologist is in the building, will do the AAC assessment. And so the team members may vary, but the biggest things are just communication, having meetings, tracking progress, and trainings are huge. Like we typically, I've gotten resistance a lot of times, and by certain staff members as well in terms of implementing the device in the classroom, and so in knowing how to use the device. So so it's really important for a speech pathologist to we have so much to stay current on, but if we have a kiddo that is using a device, we really need to be current on that program, how to edit, how to all of that, so that we can implement it and do trainings to paraprofessionals, to teachers and other staff members, and then to parents. I feel like there's a lot of times there's a disconnect where parents are not trained properly, and then because they don't know how to use the device, they just they don't use it at home because it's not they just weren't trained properly and they don't know how to use it. So how can they model? Because for AAC, sort of backtracking to another myth, we used to do like hand over hand forcing the device. I'm not sure if it's really a myth or not, but it was just a technique where you do hand over hand. We don't do that anymore, although some people still do, but we shouldn't do that. We should be modeling, just like language, verbal language. If you force a child to use AAC, and I've experienced this myself where I had a parent who I was trying to educate that, I think she just wanted him to use it so badly to communicate that when I wasn't there, she literally told me, I do make him touch, and I'm like, touch the buttons. And then, when I would come for the sessions, he would push it away. So anytime we're forced to do something, it's going to backfire. So we don't want to force that either. I kind of got off track, but so just being patient. Also, if we're with our kiddos who are learning to use AAC,
Mhm.
especially speech generating devices, we want them to pick it up really quickly. But actually, if you think about it, they're almost essentially learning a new language. These are symbols. So first of all, their verbal language is their verbal language is not fully developed, and then you want them to learn how to use a new language output system through symbols. And so it takes time. And so don't get discouraged if they don't start using it right away. Some kids pick up on things pretty quickly, and then other kids, it just takes time. But it's going to take time anyway. Whenever you learn a new language, it takes a long time. So just try not to get discouraged and just keep modeling that communication. And then the speech pathologist and anyone working with, well, especially a speech pathologist, to be taking data and just, like with any other child in speech and language therapy, you're going to monitor the progress and see, is this working? If it's not working, what do we need to change? And then just checking in at home too. Hopefully they're taking it home. If it's their own device and parents are using it, just kind of get a feel for how parents are feeling and how comfortable they are with the device and how it's going at home, to see if you need to do any further training or help in any way to, so that the device is used at home as well, because you want the child to be using it everywhere, because the more they use it, then the more likely they are to learn it and then be more efficient with it and then want to use it.
Perfect. And to that, what would be some best way a family can track progress or celebrate the progress with their kids with those devices? What would you recommend in that regard? Or what would you think are the best practices that you've seen?
So tracking, I mean, you're going to know if a child is not using it initially, if they start using it, you're going to see that they're making progress. If they're using it more frequently, or let's go back to like little progress. So, and there's new research on how to model as well, which could be a whole nother podcast. But for example, let's say we have a speech generating device, you're going to have a core words page, and then you're going to go into different pages. So if a child doesn't know anything and then all of a sudden they learn how to navigate into, let's say, the toys page, and then they pick their toy, little, just even being able to navigate into the page by themselves is progress. Just in general in communication, any small progress, celebrate it. And try not to compare your child to another child or your child to your other child. What I always tell parents is, okay, we know that your child is here because they are not, on track with they're below average compared to other children their age, or they're not hitting their milestones. We know that. So let's not dwell on that. So now that we know and you're here, we're doing the right things, you're doing the right things. Now we're going to monitor your child's individual progress. And that's super important. But in terms of AAC at home, so you're going to notice those things. I mean, if parents want to write down, some of the things that they're seeing their child do with the device and new things, that would be great. Because then they can, it's hard because, life is crazy. But if you're able to jot things down and you can see, oh, wow, he could only find his favorite stuffed animal or whatever, his favorite sensory toy. And now he can use it to navigate to 3 different pages, and he can ask for his snacks. He can tell me he has to go to the bathroom, whatever it might be. Then you can see, that they're progressing. Yeah. And so just celebrate all communication, whether it's verbal, AAC, gestures, whatever it may be.
And to kind of wrap it up a little bit, what message do you have for the parents who feel discouraged or like they're not doing enough?
Give yourself some grace. If you're feeling discouraged and you're feeling like you're not doing enough, you're probably doing everything you can. You're probably going out of your way to do every possible thing that you can. All children are unique. All children progress differently. Trust your instincts is one thing I always tell parents. The most important things, I think, are just that your child knows that you love them and you're trying, and you can always seek out more advice, but just don't be so hard on yourself if you're doing everything you can. The progress doesn't always look like the way that we want it to look, and just give it time, and just don't compare. Also, you really just don't compare, your progress and your child's progress and what you're doing with other children, other people. Yeah.
Well, no, thank you, Beth. And thank you again for bringing your expertise to our families. I'm pretty sure I'm going to probably book you for part 2.
That's fine with
For,
me.
for where we dive into more details about new practices that you've seen emerge in your area of expertise. And I
Sure.
feel this conversation will really help parents, that are starting with their child on an AAC device or are starting to get frustrated or doing a lot of that comparison game. And I think
Yeah.
I, I've always been huge on this. We already have to like fight half of the world for services for our kids, to on
Yeah.
top of that have to also do that comparison game with other children or even within our own parents in our own community.
Yeah.
So thank you very much for shining light on that, and I truly appreciate you being here and giving us some of your time.
Yeah. The other thing, if you don't mind, I'd like to say is for parents to even when you're dealing with professionals, I mean, I feel like one of the things that I feel we as professionals don't always know, and to be honest, if I'm being 100% honest, I didn't know until I started going into homes and building relationships with parents and seeing what they have to deal with on a or what they're going through on a daily basis. Like we have degrees, we have, clinical knowledge, we have our ideas of what may be best for your child, but that doesn't mean that that's what's best for your child. And you know your child the best. So I always tell parents that when you're working with professionals, make sure you're comfortable with them. Make sure you know that they respect you and that they know that your my dad would call it, I think it's empirical knowledge, but your knowledge, that experience that you have with your child day in and day out, you are the expert. It's not even us. And so I like to I like to do some education also to professionals on not coming in and saying, this is what you need to do. And, there's this, anyway, you know your child the best. You can seek out, professionals to get some advice, but make sure that they're respecting you, that they take the time to really know your child, because knowing the child is how we're going to be able to help the child. Make sure they see strengths in your child. Make sure you feel comfortable with them. And if someone, don't worry about what other people think, because you're the one that knows. And if you're getting advice that you don't agree with, it's okay to not take it. And it's okay to look for other advice, because there's, I mean, I could go on, but there's not one way to do one thing. And all children are different, no matter what diagnosis they have. So, you're going to know what they need by being with them day in and day out. So just have confidence in what you know as well. That's really important.
I completely agree with you. And that's how we met. We met through social media and through you read a couple of my books, and one of them
Mm,
is on that, on how like humility opens a lot more doors than
yeah.
credentials ever does. And it's the reality. I've been on the other side as a professional as well, going into, families' homes and helping, and that's true. And you do see it in different professional fields of
Mm,
profession. I think that's where it really comes in hand when you do build those rapports, like you with your families. You get to know
yeah.
them. The child opens up more to you. So therefore now the
Yeah.
child might do the AAC device like the child might do it with the parent. And also, I know you
Mm,
earlier, you also mentioned how parents need to be trained on those AAC devices. I don't know if many families know, but you could request some time within that IEP. So the speech pathologist you could get 30 minutes or an hour, one-time hour for training, or once every 3 months training on the AAC device to be added to that IEP.
in the service page?
And service,
Oh, I
yeah,
didn't even know that. That's
oh,
awesome.
yeah, you can. Gotten that.
Yeah.
It's called
That's
consultation. They're in consultation for 30. Yeah, it depends on what the child needs. But if
yeah.
an AC device added to that IEP, you can actually add a parent consultation to that IEP. The parent can be trained, and the justification behind that is consistency. If there's no consistency at home with school, he might do great at school, where we might see a decrease of those other ways of communicating,
Yes.
the patterns of communication, and decrease and an increase at home, and the parent doesn't know why, or vice versa. Sometimes it's because the AAC device is used adequately and correctly in one setting and not in the other.
Exactly.
Doesn't come through to the other end. So just in case families didn't know, that's another a little
Yeah.
that can happen if you're having issues knowing what the child is doing at school with that AAC device. You can get that consultation through the IEP as well. But thank you again. Do you have anything else to add, Beth, or any other?
I was just thinking, so just working with bilingual and like in multicultural families. I work a lot with Hispanic population, but also in my new contract position, we have children and families from all over the world. And so it's very important for us to know. I know you in your book, you talk about cultural competence versus cultural humility. And it's important for us to know if we have a kiddo or a family from a certain culture to, go out of our way to learn more about that culture, whether it's asking about it or researching it. When I'm thinking about AAC devices, I know for some of my families that I'm working with now, culturally, sometimes it's not the norm or it may not be accepted. And so that's another, parents have talked to me about, that's another sort of not a barrier, but just a hesitation. And then, sometimes they want, I have family that wants it at school, but not necessarily at home and in the community. Um, there's just so many layers of, and as professionals, sometimes, we're quick to judge. She doesn't want, they don't want to take the device home, or they don't want to be more involved. I know in some cultures, just respecting the professionals that you're working with, that your child is working with, and not asking questions is just culturally respectful. We look at it as Americans look at it as, oh, you're not interested or you don't care. So those cultural differences are really important to know, so that we as professionals are not judging parents. We shouldn't judge anyway, but we're, to just,
Bring
it just
your implicit biases in the house.
exactly.
Yeah,
Yeah.
definitely.
So
So,
I don't know if that was kind of off topic, but those are just I could go on. There's a lot of stuff. Yeah.
oh, and it's not off topic. I mean, because these are the professionals that do come into our household, to work with our children. And I too, as a professional that also works with families, you have to be self-aware. That's the
Yeah.
biggest, have that metacognition to look at yourself and say, how would I take it if it was done to me? Not going into that household, thinking like, oh my God, there's the why is the mom sitting over there and not engaging here, and a lot of the times
Mhm.
it's cultural or very direct. I've had parents that are extremely direct, and I'm already direct myself, but they feed me in directness. So at times I'm like, I'm taken back, but I understand, okay, that's how they are.
Yeah.
Let's just see where we have to meet them halfway, and
Mhm.
stay open and stay, willing to learn. And I think
Humble. Stay humble, like
and
you
then
said.
and then I think as professionals, sometimes when we're put in an uncomfortable situation, we immediately want to, "Oh, let's pack up. We're ready to go," but I think the professionals that are really there to help parents feel it. They're the ones that sit there through parents crying. So not try to solve anything, just listen at times.
Yeah.
Professionals ask me, well, what should I do when parents don't want to move forward with something that's being addressed? Give them time.
Exactly.
It's okay to not rush the data. It's okay to not check that box for today if they need time to process.
Yeah, and it's also okay if I make a suggestion and it's not something that you as a parent want to do. That's okay. I always tell parents that too. This is your child, This is your child and you know your child that your best. You know what your goals are for your child. This is your child, so I can recommend this, that, and the other thing. But if you don't agree, then it's okay. And I mean, you're not, as long as you're not neglecting your child, you're not putting them in danger. The choices that you're making are okay. And you may very well know much better than I do what's good for your child because it's your child. Either way, it is your child. And so sometimes we also, as professionals, forget that too. Like, this is someone's child. Like, they can make decisions for their child, and they are likely in, the best ones for them and their families. Yeah.
Yeah, completely agree with that.
Yeah.
Ah, okay. Well, continue here for another hour, but I
Yeah.
will definitely invite you back again, and maybe we
Okay.
might even do it the Spanish version for our Spanish listeners.
Okay.
So We'll dive in a little bit more into that later, but thank you everyone who stayed and listened, and hopefully you learned a lot. We're here to help. Check us out again in 2 weeks. We'll load another episode for all our listeners, but have a wonderful day, and thank you again for listening to Voice Beyond the Spectrum, the Resource Hub edition. Have a wonderful one. Thank you so much for joining us on this special Resource Hub edition of Voices Beyond the Spectrum. A heartfelt thank you to our guest, Beth Abinya, speech and language pathologist, for sharing her expertise, her compassion, and the incredible work she does every day to support our families. A huge thank you to Brad Kalub and Sophia Chinen for the beautiful music. You can listen to Voices Beyond the Spectrum on Apple Podcasts, Spotify, YouTube, and Podbean. You can also find more information on empathy for autism. We're excited to launch this new resource hub, and we can't wait to bring you more tools, stories, and support. Thank you for being part of our community.